Hello to all of you. I am Vishnu. So today I am going to talk about tetracycline antibiotics. Actually, I was on a gap because I was actually involved in some kind of work, my departmental works, and I was not that much well as well. So I just got a bit busy. So after a gap of 1 month, I am back. I wish to thank all of you who subscribe to my channel till now. Many of you support me in my activities. You know very well that this is free of cost. I humbly thank you all for your support. Today's presentation is regarding tetracyclines. Here you will get a lot of practical knowledge. Obviously, it is all theory. From theory only practical knowledge comes. But I don't believe in directly giving theoretical knowledge, because theoretical knowledge is already available everywhere. How can you visualize it practically? That is what this presentation is going to help you with. If you are preparing for competitive exams, if you want to develop your practical knowledge, if you are in antimicrobial stewardship department where you deal with tetracyclines in maybe in your hospital rounds, or maybe some patient is under any kind of tetracycline, then this presentation will definitely be of service to you. So without any delay, let's go into the presentation. So basically, the major difference between bacterial and mammalian ribosome is that mammalian ribosome is 40S and 60S. So you know very well that ribosome is a cell organelle which helps in protein synthesis. But bacterial ribosome consists of two subunits. The upper subunit is called 30S and the lower subunit is called 50S. So that is why we have some antibiotics which actually target the ribosomes, and therefore they prevent protein synthesis. So they are of two types. Protein synthesis inhibitors are of two types. One is bacteriostatic in nature and the other is bactericidal in nature. Bacteriostatic, for example, we have macrolide antibiotics, we have chloramphenicol, we have tetracycline, the presentation about which I am going to talk about. And if you are talking about bactericidal, then definitely we have aminoglycosides as the most common example. Now, the problem with tetracycline and chloramphenicol I'll come towards later. The problem with tetracycline and chloramphenicol is they not only target bacterial ribosomes, but they target mammalian ribosomes as well. And that is why the risk of side effects or the side effects that they produce are usually very horrible, because they target mammalian ribosomes also. So if they inhibit the protein synthesis of mammals, then it is a matter of concern. That is why tetracyclines and chloramphenicol should only be used in those kind of patients where the situation is very serious and alternate options are not available. Otherwise, directly you should not go for tetracyclines and chloramphenicol. If you classify tetracyclines, we have first generation, second generation, and third generation. So this classification is based on the source of origin. So first generation is usually a natural source. Second generation is a semi-synthetic source. And the third generation is purely synthetic in nature. So first generation, we have tetracycline. We have dimeclocycline. Dimeclocycline is not very commonly used nowadays. We have chlortetracycline and oxytetracycline. If you have studied medicinal chemistry, the structure of tetracycline is very important. So there, this different structure sometimes you may have to study. If you look at the second generation tetracyclines, then we have doxycycline, which is very, very commonly used. Since I am working in antimicrobial stewardship department, doxycycline is very commonly used. Minocycline is usually used in very severe conditions, especially there are certain infections, especially the infection caused by Acinetobacter baumannii. Acinetobacter baumannii is a very dangerous infection that can happen in the blood, that can happen in your, respiratory system. Sometimes it is found in the urine as well. But nowadays, the problem with this organism is that it is resistant to most of the antibiotics, especially carbapenem as well. That means it is resistant to meropenem, imipenem, etc. So in those conditions, we usually go for maybe polymyxin B, we go for colistin if it is sensitive, and then sometimes, in some cases, minocycline is also sensitive. So minocycline is reserved for those conditions. Then we have LYME-cycline. LYME-cycline is a very, very interesting molecule. If you are suffering from pimple or acne related problems, then you can use LYME-cycline. And the dose of LYME-cycline is also very spectacular. Usually, I don't tell people to study doses, but if the dose of a particular medicine is very interesting, then what's the problem in remembering it? The dose of LYME-cycline is 408 milligram. Once again, the dose of LYME-cycline is 408 milligram, 408. So that is very, very, special kind of dose. It is usually used in acne conditions. If you are suffering from severe acne on your face, body, on your arms or shoulders or something, then LYME-cycline is a good drug of choice. Raleigh tetracycline is usually not used nowadays. We don't find it very commonly. The third generation is very dangerous. That is TJ-cycline. TJ-cycline again, if you are going for hospital duty, this is something that I want to say very, very carefully, and you should listen to this very carefully as well. If you are going for hospital duty, or if you are working in antimicrobial stewardship department, or if you are a clinical pharmacist in the general perspective, please make sure that if tetracyclines are used, especially TJ-cycline, as you can see below, if TJ-cycline is used in a patient, then definitely you should monitor the patient for pancreatitis. You should monitor the patient because if you look at most of the literatures, TJ-cycline is associated with a high risk of mortality. So TJ-cycline we directly do not use simply. It should be used in very, very severe conditions based on the risk versus benefit ratio. Now, if you look at the mechanism of action, these are some steps written here, 5 steps in which tetracyclines show their mechanism. First, it enters the body through whatever route of administration. It enters into the organism, susceptible organism via passive diffusion. Then it binds to the 30S subunit. As I told before itself, bacterial ribosomes have an upper 30S and a lower 50S. So it binds to the upper subunit, which is reversible in nature. It prevents the binding of tRNA to mRNA ribosome complex. That is why it is written in brackets. It prevents the binding of tRNA to mRNA ribosome complex, and as a result of which protein synthesis is inhibited. Once again, as I said before, it is bacteriostatic in nature. It means it prevents the multiplication or growth of the organism, but it won't kill the organism. So this is just a snapshot that I took, which can help you understand how tetracyclines work in the body. You can see very well in this picture that tetracycline directly target the 30S ribosome, 30S subunit of the ribosome, and then it prevents the binding of tRNA to mRNA ribosome complex. So as a result of which protein synthesis will not happen. If you look at the spectrum of activity, which are the different organisms against which we can use tetracycline, we can use against gram-positive cocci, that is GPC. We usually say it in short form, GPC. So we can use it in MRSA, Staphylococcus aureus. MRSA you know very well. There is a very interesting fact that I would like to say about MRSA. If a particular culture report shows MRSA, we cannot give penicillins, we cannot give cephalosporins. Obviously, monobactam and carbapenem will not work much. Monobactam also, because carbapenems usually work against gram-negative organisms. But there is an exception. We can use 5th generation cephalosporins. Once again, if a particular culture report shows MRSA, we cannot use penicillins, we cannot use cephalosporins, but we can definitely use 5th generation cephalosporins. 5th generation are very, very recent, like it came into the market maybe 5 or 6 years back. The examples are ceftaroline, ceftobiprole, and ceftolozane. So they are effective against MRSA. But since they are not very commonly used here, usually when MRSA infection comes, we usually go for vancomycin. Again, we have to look at the serum creatinine and kidney status of the patient. Or we can go for linezolid as well. It is an oxazolidinone antibiotic. You can refer about that in my previous videos. I have talked about oxazolidinone antibiotics. So in MRSA, we can give tetracycline also. And then Streptococcus pneumoniae, in that condition also, we may give tetracyclines. Gram-positive bacilli, the short form is GPB. So this is actually an organism which causes anthrax. Anthrax is not very common nowadays, so it's not a big matter of concern, but just for your information. So Bacillus anthracis is the organism that causes anthrax. So against that, we can use tetracycline. Gram-negative rod organisms. For example, Brucella species, it actually causes brucellosis. Helicobacter pylori. So if you are a fourth year PharmD student, or if you are any student who has studied about peptic ulcer disease, then you know very well what Helicobacter pylori is. It is a microaerophilic bacteria which usually causes peptic ulcer disease. So in the treatment of peptic ulcer, we usually give a combination of antibiotics, proton pump inhibitors, and maybe prostaglandin stimulating agents. So one of the antibiotics that is used is tetracycline. The other antibiotics that are used in peptic ulcer can be clarithromycin. We can use amoxicillin clavulanic acid, and definitely you can maybe choose among this depending on the therapy. Vibrio cholerae. So this is a very common disease. It is also one of the most dangerous dehydrating disease. Why dehydrating? Because when you are suffering from cholera, you will have typical water-colored stools. The stools will be totally watery, which results in severe dehydration. So that is why many people who attain mortality or who actually die from cholera usually happens due to hypovolemic shock, because so much of fluid is lost from your body. So that is why in cholera, the drug of choice is doxycycline, and along that we give fluid and electrolyte replenishment. And then we have Yersinia pestis. So Yersinia pestis is actually responsible for plague. Plague is actually a very, very notorious disease which was prevalent in the 14th and 15th century. You know very well, maybe you have heard of the term the bubonic plague, or it is also known as the Black Death. So against that also we can give tetracyclines. It is also effective against anaerobic organisms. Anaerobic organisms are those who actually function even in the absence of oxygen. So, for example, Clostridium perfringens, this is usually responsible for gas gangrene. We have three types of gangrene: dry gangrene, wet gangrene, and gas gangrene. So, Clostridium perfringens usually causes gas gangrene. In that condition, we may give tetracyclines. Then we have Clostridium tetani. So this is called tetanus. Usually tetanus nobody will suffer from, because even if we get a small cut also, we usually take a TT. But by chance you happen to get tetanus, it is a very, very notorious disease because it causes a phenomenon known as lock-jaw phenomenon. Lock-jaw means the jaws will be totally locked. You will not be able to speak properly. So if you are not able to speak properly, if you feel that your jaws are completely locked, then definitely you will not be able to breathe properly. You will not be able to swallow food or something. And sometimes what happens, the throat muscles also get constricted. In that condition, there is a tendency that you may not be able to breathe properly also. So it's a very painful condition. So that is why if you get a cut or something, then please get a TT rather than suffering from this horrible condition later. Then we have spirochetes. So these are also special kind of organisms. For example, Borrelia burgdorferi, Leptospira interrogans, and Treponema pallidum. So treponema are actually those organisms which cause a sexually transmitted disease which is known as syphilis. Usually in syphilis, penicillin is more than enough, but we may give tetracycline as well. Then we have mycoplasma. So mycoplasma is another kind of organism. So it causes mycoplasma pneumoniae. That is the name of the organism. So if you are having pneumonia due to mycoplasma, we can give tetracycline. And we have chlamydia and rickettsia. So regarding all of this, I will be talking later when I talk about the uses in detail. So there we will talk about this in much more detail. Now, any antibiotic, if it is used, there is always a risk of resistance. So how does the resistance happen, if at all it happens? First mechanism is efflux pump. First of all, you should understand what is the meaning of influx and efflux. Influx means something is coming from outside to inside. Efflux means something is going from inside to outside. So efflux pump means it is a pump which is throwing something from inside to outside. So efflux pump means the bacteria develops a particular kind of pump known as efflux pump, in which when the antibiotic enters into the bacterial cell, the bacteria will use this particular pump to throw the antibiotic out of the cell. So definitely if the antibiotic goes out of the cell, then it will not function. Bacteria releases some certain kind of enzymes which actually destroy the drug. And then bacterial proteins block the drug from binding to the ribosome. So on the surface of the bacteria, there will be some proteins. So I mean inside the bacteria, there will be some proteins which will block the binding of the tetracycline to the ribosome. That is the 30S ribosome. So these are the three mechanisms by which resistance may occur. The risk of cross resistance is very low. So this is actually a good news. If you are resistant to a particular tetracycline, it doesn't mean that all the tetracyclines will be resistant. But again, you have to look at the medicinal chemistry and lot of other things to determine whether some other tetracycline will work or not. But in general perspective, the risk of cross resistance is very minimal. Let's talk about the absorption. The absorption is very good. So if you are using divalent or trivalent cations, or if you are consuming any kind of medication which is divalent or trivalent cationic in nature, that will form a complex with tetracycline which is not absorbable in nature. So that is why it is always advised that you should avoid dairy products, because dairy products contain calcium which is divalent in nature. You should avoid magnesium supplements. Magnesium supplements are also available, and magnesium antacids are also available. You should avoid calcium supplements or calcium-rich antacids, and definitely aluminium also, because aluminium is trivalent in nature. Magnesium and calcium are divalent, aluminium is trivalent. And also iron supplements, because iron usually comes in ferrous sulfate, ferrous fumarate and all. It is divalent in nature. It doesn't mean that you should not take these medicines at all. You should keep a sufficient amount of gap between tetracyclines and this kind of supplements or medications. That is what the advice is. So if you are getting up in the morning and you are thinking to take a tetracycline, or if the doctor has written in the prescription like that, and if you are taking a tetracycline, please avoid consuming tea or coffee, especially coffee if it is rich in, if it is milk oriented, because we have black coffee also and we have milk coffee also. Even black coffee is also bad. I'll come to that later. But milk, because it contains calcium, it will be a problem. Doxycycline and minocycline are the only tetracyclines which are available as both IV and oral forms. All the other tetracycline have a single administration route, but doxycycline and minocycline can be given as IV and oral forms. Let's talk about the distribution. So these drugs usually concentrate in bile, liver, kidney, gingival fluid, and skin. So these are the areas where these drugs tend to concentrate. So you can understand very well that since they concentrate in these all areas, there are risks of side effect in these all areas. So in liver, it may cause hepatotoxicity. In kidney, some of them are nephrotoxic in nature. Gingival fluid, then it can cause problems with the gums. And if it concentrates in the skin, and if you are going outside and you are already a person who is very sensitive to sunburns, then definitely it can cause photosensitivity reactions as well. Tetracyclines usually bind to tissues that undergo calcification. Calcification means which involves calcium. So that is why usually the areas, the tissues which undergo calcification are usually the teeth and bones because they are rich in calcium. And that is exactly the reason why tetracyclines can cause dramatic side effects in the teeth and the bones, especially in children. It's not that it will cause in all the age groups. This problem has been most commonly found in evolving growth. Evolving growth means what? When a child is growing, his tissues, his organs, everything is developing. So during the evolving phase, if tetracyclines are used, then it can cause dramatic problems. And definitely, if there is any kind of tumor in which calcium content is very high, tetracyclines tend to bind to that as well. Minocycline and doxycycline, they cross the blood-brain barrier very easily. So they achieve good concentrations in the CSF. So that is actually good for CNS infections. So if you are suffering from any kind of CNS problem and minocycline and doxycycline are sensitive, then definitely you can go ahead with it. Minocycline has another interesting feature. For example, you are in contact with a person who suffered from meningitis. And maybe if that person was suffering from meningococcal meningitis. So maybe you came in contact with the person, you used the person's material, anything like that. In that condition, you can use minocycline as a preventive molecule or a preventive medication because minocycline attains high concentration in the saliva and tears also. So it is very good for eliminating meningococcal carrier state. So for example, even if you got it from somebody also, you will not spread it to others. The purpose of actually taking that medication is the purpose of taking a prophylactic medication is not just to prevent yourself from getting the disease, but also to prevent yourself from spreading the disease to others. So if you are taking minocycline as a prophylactic medication, it attains high concentration in saliva and tears because these are usually produced in higher concentration. So that is good for eliminating meningococcal carrier state. So by chance, if meningococcus has entered into your body, then definitely minocycline will take care of it. All tetracyclines, they cross the placental barrier and they concentrate in fetal bones and dentition. This is very important. That is why tetracyclines are contraindicated in pregnancy. Because there are two reasons why tetracyclines are contraindicated in pregnancy. Number one, they cause severe hepatotoxicity if used in pregnancy. And if the woman already has a liver problem, then I don't need to explain further. The second reason is they cross the placental barrier and they concentrate in the bones and the teeth. Dentition means teeth apparatus of the fetus. So when the child will be born, bones will not grow properly and there will be problem with the teeth as well. So this kind of children will not get good height. So they may have stunted growth. They may have growth problems. If you look at the elimination, tetracyclines are eliminated via urine, and that is why dosage adjustment in renal disease is very, very important because they are eliminated via urine. Minocycline and doxycycline, they are usually eliminated through fecus. So that is a exception. So minocycline and doxycycline, they are usually eliminated through fecus. Now let's talk about the adverse effects of tetracyclines. Tetracyclines usually irritate the gastric mucosa. So as a result of which, epigastric distress can also happen. Now, there is a practical knowledge that you can connect this with. If you have heard of the treatment of osteoporosis, and if you remember a class of drugs known as bisphosphonates, alendronate, risedronate, ibandronate, zoledronic acid. Zoledronic acid is still okay, the remain. There also we give the same counseling. Because if a person is taking a bisphosphonate for osteoporosis, that person is advised that if you take the medication, take it with sufficient amount of water and do not immediately lie on the bed. If you are immediately lying on the bed, then it can cause esophageal ulcers. That is why you should sit straight for minimum 15 to 30 minutes or maybe even more for some medications, and then you can lie down on the bed. Same thing with tetracyclines also. If you are taking tetracycline and if you immediately go to the bed, there is a high risk of esophagitis. That means inflammation of the esophagus. That is why, just like we advise for bisphosphonates in osteoporosis, same thing here also we advise patients that no matter whenever you are taking in the day, you should take this medicine and sit upright for 15 to 30 minutes. After that, you can go to bed. Usually, you can take this drug with food also, except dairy products. As I said very well, they are rich in calcium, so it is a divalent cation that is a problem. Tetracycline should be taken on an empty stomach. So tetracycline and tetracyclines both are different. Tetracycline is an individual molecule and tetracyclines are class of drugs. So tetracycline should be taken on an empty stomach. And if you want to reduce GI distress due to tetracycline, you can use capsules instead of tablets. So if a particular tetracycline is available in a capsule form, that can be preferred for those people who are already suffering from GI problems. So if capsules are used instead of tablets, GI problems may be reduced. As I said before, if you're taking tetracyclines and immediately if you go to bed, there is a high risk of esophagitis. So please sit straight for at least 15 to 30 minutes after taking the medication and then only go to the bed. Now there is a problem. Tetracyclines are usually acidic in nature. If you are a person who takes lot of cold drinks, especially caffeinated products, if you are a person who drinks a lot of black coffee, if you are a person who takes lot of green tea, because green tea also contains caffeine to some extent, then tetracycline may not be a very good option for you. Why? Because tetracyclines are acidic in nature and caffeine is also acidic in nature. So if you are taking caffeinated beverages or if you are taking acidic beverages, caffeinated beverage, for example, coffee, green tea, etc. And if you are taking acidic beverages, for example, cold drinks, most of which contain carbonic acid. In that condition, please avoid those combinations. Like for example, if you are taking tetracycline at this time, if you want to drink coffee or drink green tea or something like that, then try to either take it maybe a few hours before tetracycline or few hours after tetracycline. Don't do both of them at the same time. So tetracyclines are acidic in nature. Please avoid it with caffeinated or acidic beverages. Tetracyclines usually attach to the bone and dentition, as I said before. So in children, usually the bone and teeth keep on developing. So if you are an adult, it is not a problem because it is already, your bones and teeth are already developed. But if it is a child below the age of 8 years, the organs are developing, which also includes the bone and teeth. So if tetracyclines are used in such kind of children, then there might be a risk of tooth discoloration. So it will appear yellowish in nature. Tooth hypoplasia. Plasia means growth, hypo means stop or reduce. So there will be a problem with the proper growth of permanent teeth and definitely stunted growth. Why stunted growth? If the bone does not grow properly, your height will never develop. So it can cause stunted growth. As a result, tetracyclines are contraindicated in children below 8 years of age. It may be hepatotoxic in nature. Usually, if you are using in too much of high dose, it may happen. If you are using in pregnancy, it may happen. If there is a pre-existing liver disease, for example, you are suffering from hepatitis or jaundice or chronic liver disease or hepatocellular carcinoma, anything related to liver, any problem related to the liver, then you may get this problem much more severely. And also pre-existing renal disease, right? See, all the tetracyclines are hepatotoxic also in nature. So if you are having renal disease, means the tetracycline will not get eliminated. So they will stay in the body. So that can increase the risk of hepatotoxicity. So we have to be very careful regarding that. Phototoxicity is also seen. Tetracyclines are the best friends of sun rays and UV rays. So what happens is, when best friends meet each other, they always maintain an intimacy. So if a patient is taking tetracycline will try to absorb the UV rays or sun rays, and absorption will happen through the skin. So if you are a person who already suffers from skin issues, or if you are a person who is suffering from SLE, systemic lupus erythematosus, or maybe psoriasis, or any kind of sunburns or skin related problems, then this can be dangerous for you. That is why usually patients are advised that if you are under tetracycline therapy, you can use some kind of sun protective measures, maybe sunscreens or SPF and all this kind of things you can use. The highest risk of phototoxicity is seen with tetracycline and dimeclocycline. Vestibulotoxicity is usually seen only with minocycline. Vestibulotoxicity means it is actually related to the ear. So minocycline usually concentrates in the endolymph of the ear, and it will damage the endolymph. So as a result of which it can cause hearing problem. And you know very well that the functions of the ear are two in number. Number one is hearing, and number two for maintaining your equilibrium or balance. So it can cause dizziness also, or maybe vertigo, and tinnitus. Tinnitus means tingling sensation in the ear. You will constantly feel some kind of a low pitch sound or something like that ringing in your ears. This is very rare. It's not very commonly seen. It's called pseudomotor cerebri. So tetracyclines can cause benign intracranial hypertension, which is known as pseudomotor cerebri. So it can cause headache or blurred vision. So if you are under tetracycline therapy and you are experiencing blurred vision, then definitely you should report to the physician or the pharmacist. But the good news is, if the drug is discontinued, then the condition gets automatically reversed. If we talk about contraindications, as I said before, pregnancy and definitely lactation, because tetracyclines can go through the breast milk also. And definitely lactation means the child will definitely be below 8 years of age. In that condition, it can cause growth and dentition problems or teeth related problems in the child. And definitely children below 8 years of age, we should not be using tetracyclines. Now let's come to the uses of tetracyclines. So the first use is Helicobacter pylori. So this is actually an organism which causes peptic ulcer disease. So in this, as I said before, we have a lot of antibiotics which can be used. We have anthelmintic also, metronidazole, tinidazole, which can also be used. So we can use clarithromycin, which is a macrolide antibiotic. We can use amoxicillin clavulanic acid, which is bactericidal in nature. It is penicillin. And definitely we can use tetracycline as well. So this is the organism Helicobacter pylori, against which we can use tetracycline. The next disease in which we can use is Lyme disease. So it is caused by an organism known as Borrelia burgdorferi. So you can see it in the picture, where it is a worm-like kind of organism. So the symptoms have been shown here. It can cause a rash, which is usually like resembles bull's eye. If you closely see the image on the left hand side, you can see that there is a rash which appears like a bull's eye. And it can cause facial palsy also in very severe cases. Because of neurotoxicity, it can cause facial palsy, paralysis on one side of the face. It can cause swollen knees as well. So Lyme disease is caused by Borrelia burgdorferi, and this is actually spread through the bites of infected ticks. So you can see very well there is an insect on the left hand side. So it's a black-legged tick. So if it bites you, this organism can enter into your body. It can cause skin lesions, fever, headache, meningoencephalitis. So it can inflame the tissues of your brain, and it can cause arthritis as well. The skin lesions usually represent a bull's eye with a reddish outer ring. So that is known as erythema migrans. So this is a characteristic feature of Lyme disease. The drug of choice is doxycycline. Mycoplasma pneumoniae. So you can see in the picture, this is also known as walking pneumonia. So this is not very common. It actually happens in people who stay in extremely closed areas, enclosed areas, where there is improper sanitation as well. So especially in military camps or in jails and all this area, we can see this problem. The drug of choice is macrolide antibiotics and doxycycline. So this is an organism known as Vibrio cholerae. So cholera, as I said, it is one of the most dangerous dehydrating infections because it causes dehydration to a severe level in which mortality can also happen. So this organism enters into the body, multiplies in the gastrointestinal system, releases a toxin which is known as enterotoxin, and that causes severe diarrhea. So the drug of choice is doxycycline plus fluid replacement therapy. Then we can use in two different type of chlamydial infections. One is called Chlamydia psittaci and another is called Chlamydia trachomatis. Chlamydia psittaci usually causes a disease known as psittacosis, which you can see on the left hand side. It leads to a condition known as pneumonia. Mainly it causes pneumonia, but it can cause hepatitis, inflammation of the myocardium. So it is called myocarditis and even death due to coma. And on the right hand side, you can see Chlamydia trachomatis. So this is actually a sexually transmitted disease, and it can lead to urethritis, inflammation of the urethra, pelvic inflammatory disease, and lymphogranuloma venereum. So all these are technical terms of sexually transmitted diseases. So the drug of choice is doxycycline and azithromycin. So these are the two different types of chlamydial infections against which we can use tetracycline. Then next we come to Rocky Mountain spotted fever. So this is caused by an organism known as Rickettsia rickettsii. This is not very common here. It is usually common in United States and those kind of hilly areas mainly. So this is also transmitted by ticks. As I showed in another disease, Lyme disease, this is also transmitted by ticks. The symptoms include fever, chills, bone and joint pain. Bone pain, a bone or joint pain is usually known as arthralgia. Now let's come to some interesting facts about tetracyclines. They are ineffective against Pseudomonas, Providentia, Morganella, and Proteus. See, these are four organisms which I have mentioned here. If you are going for hospital duty, if you are working as an antimicrobial stewardship pharmacist, or if you are working as a clinical pharmacist in general, these four organisms you should be knowing very well. Pseudomonas aeruginosa, Providentia rutgeri, Morganella morgani, and Proteus species. We have Proteus mirabilis, which is a causative factor for UTI as well. These are very, very common infections, especially Pseudomonas is very common. So if you are getting a culture report in which Pseudomonas aeruginosa is seen, you can forget about tetracyclines, they cannot be used. If you get a culture report in which Providentia rudgeri is seen, you can forget about tetracyclines, it is not effective. If you see a culture report in which Morganella morgani is seen, you can forget about tetracyclines, it is ineffective in the same. And definitely in Proteus also, tetracyclines are ineffective. Minocycline has 100% absorption. Tetracyclines are usually given IV or oral. The problem is if tetracyclines are given intramuscular, it causes severe injection site reactions. It can cause pain and inflammation. And that is why tetracyclines should never be given intramuscular. It is given IV or oral. Tetracycline 1% topical formulation is also available. It is used for the prevention of ophthalmia neonatorum. So this is for children. It is actually a ocular disease. So to prevent that disease, we can give tetracycline as 1% topical concentration. Doxycycline is the drug of choice for chloroquine-resistant malaria prophylaxis in patients who are traveling for less than 6 weeks. So, for example, you have traveled in a particular area in which malaria is very common, and the parasite which is involved in that malaria is resistant to chloroquine. So, definitely you should be taking a prophylactic medication to prevent malaria infecting you as well. So in that condition, doxycycline is a good option. Minocycline is good for nocardiosis and leprosy. Nocardiosis is actually an organism, it is usually not very common, but if it happens, it's not a very good indication. In nocardiosis, we can give cotrimoxazole as well. Cotrimoxazole is a combination of sulfamethoxazole and trimethoprim. Minocycline can also be given, and it is good for leprosy as well. Leprosy, you know very well, it is caused by Mycobacterium leprae. Tetracyclines can cause leukocytosis as well. So, a slight increment in WBCs may be seen. Minocycline can cause brownish discoloration of skin. So, this is a specialty about minocycline. Earlier, one specialty I already told you, minocycline can cause hearing problems and dizziness because of the damaging effects in the ear. Another specialty of minocycline is it can cause brownish discoloration of the skin. Now, this is actually a special condition. The role of doxycycline in pleurodesis and pericardiocentesis. So actually what happens, if doxycycline is injected into the pleural or pericardial cavity, it causes inflammation in that area. It causes inflammation in that area. So the space between the inner areas are closed. Due to the inflammation, the space between the inner areas will be closed. So if the space is closed, then fluid cannot enter in that particular area. So this is actually good for pleurodesis and pericardiocentesis to prevent accumulation of fluid in the pleural cavity and pericardial cavity. In simple words, doxycycline prevents the accumulation of fluid in the pericardial and pleural cavity because of its inflammatory effects in those areas. Dimeclocycline blocks vasopressin type 2 receptors in the kidney. So it is good for SIADH, syndrome of inappropriate ADH secretion. So this is a condition. So dimeclocycline will block the B2 receptors in the kidney. If you consume outdated tetracyclines, it can cause nephrotoxicity like of condition, which is known as Fanconi syndrome, but it is usually reversible in nature. Now let's come to some of the newer tetracyclines. One is called iravacycline. It is given parenterally and it is good for complicated abdominal infections. One is called omadacycline. It is given parenterally. It is good for community acquired pneumonia and to prevent bacterial skin infections. It is actually good against gram-positive, gram-negative and atypical organisms also. And the speciality of omadacycline is it prevents the resistant mechanisms of bacteria. That is, it resists the drug efflux. Drug efflux will not work on omadacycline. And ribosomal protective protein, as I said in the mechanism of resistance below, the bacteria will contain certain proteins which prevent the binding of the tetracycline to the ribosome. So here it will resist that also. Sarecycline is usually given orally. It is good for acne in patients of age greater than 9 years because we haven't yet seen the safety below 9 years. So it is usually good for acne in patients greater than 9 years. So now let's come to mnemonics. As I said, all the tetracyclines are nephrotoxic in nature. And even if they are not significantly nephrotoxic, in renal failure, they can accumulate in the body and cause toxicity. But there are 3 tetracyclines which can be safely used in renal failure. To remember, use the mnemonic TDM. TDM you know very well, therapeutic drug monitoring. T stands for tigecycline, D stands for doxycycline, and M stands for minocycline. And for your information, all these medications are used in hospitals. To remember the uses of doxycycline, my pink RBC. My stands for Mycoplasma hominis, and it is not just Mycoplasma hominis, Mycoplasma pneumonia condition also. Pink stands for plague prophylaxis. R stands for Rickettsia rickettsii. B stands for Borrelia burgdorferi, brucella. C stands for chlamydia and cholera. To remember the side effect of tetracyclines, you can use the mnemonic FLOP DPT vaccine. DPT you know very well, diphtheria, pertussis, tetanus. So those vaccines are usually given in children. So FLOP DPT vaccine. F stands for Fanconi syndrome. L stands for liver damage. O stands for osteogrowth abnormality. What do you mean by osteogrowth? Osteo means related to the bones. So osteogrowth abnormality. So if it is used in children below the age of 8 years, it will prevent the proper growth of the bones. P stands for photosensitivity and pseudomotor cerebri. Actually, that pseudomotor cerebri P you can add in the last also. D stands for diabetes insipidus because it is good for SIADH. So it will actually cause increased outflow of urine. What is the function of ADH? Antidiuretic hormone usually helps in preventing the elimination of fluid from the body. So since it is blocking antidiuretic hormone, it will cause the elimination of fluid from the body, which is known as diabetes insipidus. P stands for photosensitivity and pseudomotor cerebri, and T stands for teeth discoloration because when tetracyclines mix with calcium, it causes a complex which is usually yellowish in color. And vaccine V stands for vestibulotoxicity. As I said, minocycline causes that. So this is my presentation. I hope this presentation has been productive for you. So tetracyclines in summary, they usually inhibit the 30S ribosome as a result of which protein synthesis is inhibited. Most of them are eliminated through urine except doxycycline, minocycline, etc., which undergo fecal elimination. They usually cause hepatotoxicity, they can cause photosensitivity, they cause in pregnancy if they are used, it can cause, they cross the placental barrier and they can cause growth and teeth problems in the child. And then we talked about some newer tetracyclines and what are the interesting facts. So if you appreciate my efforts, then please do subscribe to this channel and share to maximum people, because knowledge shared is knowledge doubled. Thank you so much for listening to me. I'll definitely meet you the next day with some other interesting video. Until then, it's goodbye.